Good morning, everybody. I'm Steve Pollack. I'm CEO at DentaQuest. DentaQuest is an organization that is focused on creating a shift in paradigm to revolutionizing oral health through a focus on prevention. I want to thank POLITICO for their help in organizing this morning. Definitely want to thank our panelists. I think you're going to enjoy hearing from them. And most of all, I want to thank you for joining us here for this important discussion and for those of you listening in. DentaQuest is a double bottom line company. What that means is that we have a business that's focused on improving oral health. We do that through a focus on prevention. That's through value-based care, through innovation. We really seek to get better outcomes at a lower cost for our customers, and there's 25 million people across the country that we serve. But we also believe that everybody deserves a fair shot at oral health. So we have an important social purpose, and we believe advocacy and policy play a really important role. And that's really why we're here today. We believe that getting more people involved in a discussion around oral health will help everybody get access to oral health. So I want to bring out Allison Corcoran to talk about an important research report that we just issued yesterday. It gives a 360-degree view of oral health in the United States, and I think it will tee us up for a great discussion. DentaQuest is a great organization. We have important values. If I had to summarize them in 2 words, I would say we're all in. And I invite all of you to be all in on our quest to make sure everybody gets a fair shot at oral health. Thank you. Allison?
Thanks very much, Steve, and good morning, everybody. In my work with the DentaQuest Partnership, I work with incredibly passionate change makers who are laser focused on transforming the oral health care system to enable better health through oral health. And at the DentaQuest Partnership, we do strategic grant making, we do research and analytics, as well as pursuing a variety of care improvement initiatives. In collaboration with our partners, many of whom are in the audience today, we are driving meaningful change at the local, state, and national levels. Over the years, our focus has been on systems change for oral health, advancing preventive care, as well as exploring new models of financing. Our research findings have informed our work and informed our grant making and our program development, which is one of the reasons we did this piece of research. Another reason is because I am the Chief Marketing Officer at DentaQuest. I have a keen interest in and experience with studies that explore public opinion, that understand consumer sentiment, and I believe, fundamentally, that there's always tremendous power in truly understanding the way people feel about a topic and their underlying beliefs. From that understanding, we can find those points of commonality that will help us develop a path forward to better outcomes. While we and others certainly have developed studies in the past that have looked at oral health and explored different stakeholders' perspectives, some of that data is old, and none of it has been truly comprehensive, all done at the same time. So as Steve mentioned, we identified an opportunity to sponsor a study that would provide a unique 360-degree view of the current state of oral health. We worked with a team at KRC Research to design a survey that spanned 5 critical stakeholder groups: dentists and patients, employers, because they pay for most of our oral health benefits, and Medicaid dental administrators. But also because we believe so firmly in the power of medical-dental integration, we also included physicians in the study. Having released the results yesterday, I'm happy to provide you a quick look at some of the high-level findings. So there is some bad news in the results, but there is reason for optimism as well. Our research confirmed that the current oral health system is failing millions of Americans, but that decay is reversible. We found remarkable consistency from patients, from dentists, from physicians, from Medicaid dental administrators, and from employers not only on the problems surrounding oral health in the US, but we found agreement on the potential solutions. So let's take a look. Our failing oral health system is a major public health problem. We know this because 6 in 10 patients, dentists, physicians, and employers rate the health of Americans' oral health as very poor, poor, or fair. And 9 in 10 Medicaid directors rate the health of Americans as poor or fair. And not only is our oral health poor, the outlook for the future is currently far from bright. 8 in 10 physicians predict Americans' oral health will either stay the same or get worse. And 2 in 3 dentists, patients, and employers agree. For me, one of the most surprising findings is that 3 out of 4 patients, or 75% of those of us in the room, say that we have encountered barriers to getting dental care. 3 and 4. Those issues and barriers are cost of care, lack of insurance, or various access issues that, like locked doors, prevent people who don't have the key from walking in. So the inability to take time off work to go to the dentist, or lack of transportation, or for many Americans across the country, simply the scarcity of providers in their geographic area. And most Americans are concerned about their oral health. Half say oral health is their top health concern over heart, eye, digestive, and mental health. And the same is true for parents when asked about the concerns for their children's health. So there's also clear understanding of the important connection of oral health to overall health. And this is one of the exciting findings that I think is different than we would have seen a few years ago. As you can see, nearly everyone agrees that access to dental care is critical to improving not just oral health, but overall health. And more than 90% of patients and dentists, physicians and dentists, and 79% of patients recognize a tangible connection between oral health and overall health, including connections to diabetes, heart disease, healthy pregnancies, Alzheimer's, and so forth. At the same time, there is a significant level of confusion about the benefits that are available through public programs. Most Americans believe that Medicare, at 80%, and Medicaid, at 78%, should include dental benefits. This is a widespread, nonpartisan belief. But, as we know, state-based Medicaid programs include benefits to varying degrees, and often only for children. A majority, 62% of patients, are either unsure or incorrectly believe that Medicare currently provides coverage for dental benefits, which it does not. For the 10,000 or so Americans who become eligible for Medicare every day, most experience a rather unpleasant surprise when they realize that despite having paid into Medicare all along, it does not offer dental benefits. These seniors have teeth and they vote. So, despite the negatives that I've shared, there is cause for optimism, and here's why. All the shareholder groups and stakeholder groups that we spoke to agree we can act now to help improve the overall system. Everyone agrees on the importance and the effectiveness of preventive approaches to improve oral health and overall health. So there is agreement on prevention first. Most dentists, at 93%, physicians at 86%, and employers at 82%, agree greater collaboration across medical and dental providers would improve patient care. Specifically, dentists and physicians agree that care collaboration can bring improved health outcomes, efficiencies, and reduce the cost of care. So there is agreement on the power and the future in medical-dental integration. Both patients and dentists see the value in taking care beyond the dental chair, expanding care to locations outside of dentists' offices. including schools and community centers. So there's an agreement on improving access. And not only do most American adults believe oral health should be covered in Medicare and Medicaid, most Medicaid dental administrators agree that comprehensive dental coverage in public programs would help prevent disease related to untreated oral health issues at 68% and improve the health of their state populations overall. So there is agreement on the need for and the direction in adult public benefit. And finally, most patients, physicians, and employers agree that oral health benefits should prioritize healthy outcomes over the volume of services delivered. So new payment approaches based on value-based care is a point of agreement. These ideas aren't new to us. At DentaQuest, we've recognized these problems and have been working to raise awareness about the need to transform the system from the inside out for some time through that all-in approach Steve mentioned that we call preventistry. The survey confirms much of what we believe, and it is satisfying to see that while there is strong agreement on the issues and obstacles, there is a shared view on the solutions. The findings are encouraging because they indicate that working together, we really can improve the oral health of all. The system is indeed in a state of decay, but it's reversible. I encourage you to review the full survey report. It's a very interesting and accessible read, and there's a lot more in there. You can go to dentaquest.com/reversible decay and check it out. So thank you so much for your time this morning. Thank you for caring about oral health. And thank you for your continued advocacy on the behalf of the millions of Americans for whom the oral health system is currently failing. And I know that we are all going to learn and enjoy the upcoming panel.